Hello everyone! For the third installations of enhancing the erection, we're going to talk about injecting the penis back to life. We're talking about intracavernosa injections. Well, as we previously discussed, the erectile tissues inside the penis is actually called corpus cavernosum. And that itself works by sucking the blood into the penis itself to achieve tumescence or erection, and hence trap the blood in there so that the erection can be sustained. For men who suffered from severe problems of diabetes, blood pressure and also dyslipidemia, the blood vessels itself may not respond so easily to arousal, and that itself will cause erectile dysfunction. So prior to the inventions or the discovery of the blue pills, actually one of the ways to find out how to get blood sucked into it is to inject vasodilator into the actual erectile tissues itself. In the 80s, actually a French surgeon claims that he accidentally injected the patient's penis and resulted in an erection, was reported to have this effect, and hence the discovery of medications such as papaverine and alpristadol that actually help to enhance erection. In the 21st century, it is still possible to use this in order to see whether the treatment of erectile dysfunction can be enhanced by the injection itself. However, it carries a side effect called priapism. Priapism actually derived a name from the Greek god of fertility, also called Priapus. That itself actually was disseminated to many countries such as Italy and Turkey, and many actually had adopted Priapus as the god of garden for shepherd and seafarers. But priapism itself is not necessarily a good thing, because a prolonged erection will actually allow blood to go in but not necessarily come back, and that will cause ischemia, lack of oxygen, and also gangrene, and the penis itself will go dead and permanently cause problems. So men who are so eager to inject more medications in order to enhance circulations into the penis might risk themselves having something called priapism, and that is a prolonged erection that you don't want, because that is an emergency that will derive an immediate attendance to accident emergency for an aspiration of that ischemic blood so that you can recover the function of the penis. For the final installations of enhancing erection, next week we're going to talk about the possibility of using more natural method or traditional Asian method such as the actual acupuncture. The only way to find out is stay tuned for next week's Putting Dr. G on the Spot.